I'm Marcia Ibarra, the recovering data junkie that Heather spoke about, and we'll talk with you this evening about welfare reform of the 1990s and why it still matters, right? Why are we still talking about this 20 years later? What if I told you the welfare reforms of the mid-1990s was a huge success? What if I told you it was a huge failure? It turns out it really depends on the kinds of questions you asked about what happened with reform and the outcomes that you take a look at. So my goal for this evening is to cover one of the biggest social policy changes we've had in the past 20 years, and I'm going to do it all in 10 minutes. So strap yourselves in. So what is welfare reform and what did it do? Well, first, the reforms of the 1990s were a response to criticism that the previous program created dependency. So families saw it as a permanent solution to poverty rather than as temporary during hard times. Most of the time, families who used welfare, it wasn't just that the benefits were better than low-wage work. Okay, so if you were on welfare, you might get as much as you would in a low-wage job. It was also that at that time, prior to reform, if you got a job and left welfare, it wasn't uncommon for a family to lose other vital supports. So, for example, public health insurance for your child, right? Not having child care assistance if you're going to a low-wage job. So when researchers and policymakers talk about creating a new system to make work pay, they're really referring to the old program that disincentivized work because the benefits looked a little bit better than low-wage work, and what you lost when you went into a low-wage job far outweighed what you were going to get from the private sector. So the make work pay structure of our modern welfare system takes the approach of making entry-level work more appealing than welfare benefits. First, families have to agree to either work or perform work-like activities in order to receive a cash benefit. The second thing that families have to do is that they're going to receive, if they remain low income but have a job, they're going to be able to keep public health insurance for their children. And if they remain low income, it's also pretty common for them to also receive child care assistance if they're working in the private sector. The third thing that reform did, and this was in response to making a welfare program for folks to perceive it as a temporary means of support rather than a lifelong means of support, was to make it time limited. So here in the US, federal level guidelines state that you have a maximum allowable receipt length of 60 months. Here in Texas, I actually think it's 2 years, but by federal standards, it's 60 months. So families, the hope that this would incentivize families to think of this as something that they shouldn't use often unless they really needed to use it, and if they did, that eventually it was going to run out. And the fourth thing that was done to make work pay was that there was a dramatic expansion of the earned income tax credit to essentially subsidize some of the low wages that families were receiving. So back to the big question. Was welfare reform a success or a failure? So again, it depends on the questions that are asked. For example, immediately following reform, there was a lot of evaluation that was taking place. Most of it was looking at the number of families that were enrolled. On the research side of things, we often refer to this as caseload declines. Were fewer families enrolling in the modern welfare system? And the answer was resoundingly yes. In the US, caseloads dropped by about 50%, and some states actually experienced an 80% decline in caseloads. So from a perspective of welfare reform is successful if fewer families are using the program, then the answer would be yes, we were very successful at having fewer families use the welfare program. Immediately after this, the evaluation of caseload declines, researchers began to ask a different set of questions. And those questions were around the assumption that if fewer families were using the welfare system, that didn't necessarily mean the families were actually better off, right? What were they doing in lieu of receiving welfare, and what did work look like? A number of studies drawing on survey and administrative data posed two questions to try and understand this. The first question was, do pre-reform families and post-reform families look similar? Meaning, did we so dramatically change the welfare system that what we're seeing post-reform are families who look completely different than pre-reform families, and therefore we're going to see a different set of outcomes because these families don't really line up? And the answer to that from a lot of research is that actually the families look pretty similar in terms of being mostly single-headed female families, in terms of levels of education, things of that nature. So the new welfare program really wasn't attracting different kinds of families. The second question was, how are these families in a post-reform era economically faring over time? Because the first few years, all you can really get is a sense of the caseload decline and if folks are getting employed. But over 5 or 10 years, you get a sense of if employment looks stable. And it turns out that families actually were not necessarily any better off. And so what do I mean by that? What I mean is in a post-reform era, if you were participating in welfare and leaving, wages were still pretty low. Work was fairly sporadic, whether you were cycling in and out from employment to unemployment, fluctuating hours, things of that nature. And poverty remained pretty persistent, even after factoring in work support, such as the Earned Income Tax Credit or other in-kind supports like its food stamps. The rates look better, but they're still high from a resource perspective. Among post-reform families, most are working, right? Most are earning, and most are doing it with kids. The takeaway generally from this line of research is that while reform didn't necessarily make families worse off, at least economically, it also didn't dramatically transform their lives, right? So we may have transformed the system, but as far as families who were using the system, their lives weren't transformed in kind. So in fact, researchers and policymakers have pointed more recently to evidence that suggests our work-based safety net is even more frayed than we had suspected. Part of this is in response to what happened during the recent economic downturn from 2007 to 2009 with welfare. What we know from that period of time is that yes, caseloads did rise for welfare, which you would expect them to, given the dramatic unemployment levels, especially among disadvantaged families. But the rates at which they rose were pretty negligible compared to the size of the downturn. So what we know from qualitative research is that some of the explanation for this is that families simply no longer see the welfare system is something that is going to transform their circumstances in any substantive or meaningful way. Some folks might say that the point of reform, right, was to have fewer families on the program. However, if we think that the point of poverty interventions is to lift families out of poverty permanently, clearly the current program is unable to do that. So where do we go from here? I feel like I've been a Debbie Downer so far. So I'm going to try and give us a little bit of hope. So to start, we have to look at what we already know. And we know welfare reform dramatically reduced caseloads, but did not dramatically reshape poverty in the US. No matter what end of the political spectrum you're on, I think that really is a general consensus politically and from a program perspective. The overarching goal was to put more families to work, not to reduce poverty. That's an important thing to remember, and we were very successful at that. Since reform, another important key factor to keep in mind is that the program itself has been tinkered with here and there 20 years later, but it looks remarkably similar to what we had put in place 20 years ago. So what does this mean for building evidence or implementing innovation in our current system? It means it's really tough to enact rigorous experimental research designs in the context of a large, relatively inflexible welfare program that's supported by state and federal dollars. That's not to be pejorative about the program or the great folks who work in it or families who rely on it. It's simply to say that with big bureaucracy and with wanting to serve all families, it's really difficult to do that in that context. It's simply not designed to do that, in fact. So what can we do instead to build evidence that might lead to real change in poverty for low-income families? First, large organizations like Catholic Charities that reach millions of low-income families every single year, they're less encumbered, they're more agile, and they're ready to partner with researchers in developing innovative interventions and test them to see what the effect is on poverty among low-income families. What kinds of evidence do we need? Well, from past welfare reform research, we know that caseworkers in welfare offices are overwhelmed and largely tasked with filling out paperwork with huge caseloads. So the idea of being able to have time to relationship build or trust build or be creative in attaching families to work or training, there's simply not time for it in the current system. Our current welfare program also allows for minimal training and education for families. These are things that could actually, in the long term, lift families out of poverty permanently. The current system isn't able to support that. It's also not able to support very common things that interrupt work, like your car breaks down, or you don't have a car but you have a new job, or you have a job but you need a uniform or you need tools, right? That's not part of the package with the current welfare system. So much of this seems overwhelming, sometimes so overwhelming that we might think, what can we do? Can we do something that will result in real change? And the answer, I think, is yes, but with some caveats. We must have rigorous social science evidence that tests whether or not supports not offered in our current welfare system are actually significant in changing the lives of low-income families. And we need to know whether these supports are effective in both the short and the long term in reducing poverty. In other words, we need to know that our investments are going to pay off. And we need to know this for a few different reasons. Probably the most important one is that we are not going to convince stakeholders with decision-making power that there might be a better way and a more cost-effective way at reducing poverty here in the US. Our focus should be on developing real solutions by building thorough evidence and cutting-edge intervention tools that reduce poverty in the near and the long term. Thank you for your time.